What makes your work meaningful?
So I work as a health economist now, and what makes my work meaningful is that we're sort of at this inflection point with healthcare in the US. I think it's pretty well known and debated and covered in the media that the population is aging. Demographically, Americans are getting older on average. We're having the baby boomers slowly age into Medicare, and it's going to be this huge population and this financial strain. And at the same time, we have all these lifestyle diseases like obesity, diabetes, and, Americans at one point, we were a very physically laborious population, and now a lot of us sit at desks, and we have these chronic conditions that come with a lack of physical activity. And figuring out how to finance this issue, there's these broad social and demographic changes that impact healthcare, but the healthcare system can't address a lot of the social issues, but they end up addressing the medical issues. And so as a health economist, I try and figure out, where is this money coming from? How are we going to pay for these things? What kind of incentives can we put in place economically to try and change behaviors? And it's, I was just at a talk the other day with, there was the 2012 Nobel Prize laureate who looked at behavioral economics and sort of game theory and how to incentivize different behaviors. And there's this huge intersection now between economics and healthcare. And, at a certain point, we may have a medical innovation, but it's a question of how to provide it to the entire population. Or maybe we have an innovation that costs a lot, or we may have the potential for an innovation, but we're going to have to pay a lot to make that next breakthrough. Where do we spend our resources? Do we spend them treating the population now, but then maybe robbing from our future generation? Do we hold off now so that we can invest in R&D? And so these are all questions that a lot of economists ask, and they touch a lot of our lives, and it's really fun to, sometimes aggravating, mostly fun when you read the newspaper in the morning and there's like another article about how Medicare is going bankrupt. And a lot of my job is to try and figure out how to make the system a little bit more sustainable. So.
Big work.
Yeah. If it was an easy task, someone would have figured it out by now. Sometimes I sit there and think, wow, a lot of what I get tasked with is thinking creatively, because there's been a lot of solutions that have been, or quote, solutions that have been proposed that either don't turn out the way they want, or they're politically infeasible, or the public finds them unpalatable. So a lot of what I do is sitting around just trying to think creatively, like what's a proposal that hasn't been thought of yet, or what's a proposal that's been thought of but it was rejected, and how can we change it a little bit so that it can move forward. So I do a lot of wrestling with some big issues, and it feels very meaningful because my parents just joined Medicare last year, so now it feels I'm actually working on behalf of some people I know, and it's a good program.